morning, ma'am. My name is Aliyah Grace Biscotcho from BSN 19, and today I will be performing my turn demonstration in assessing the female genitalia and rectum. So first, I will introduce myself to the client and verify the client's identity. So good morning, ma'am. My name is Aliyah, and I will be your student nurse for today. Verify lang po ng identity. May I know your name, age, and birth date? Okay. After that, I will gather the equipment that I will be needing. So I have here my alcohol, a clean gloves, and a pen light. After that, I will explain the procedure to my client, ensure my client's privacy, and ask the client to wear gown. So ma'am, the procedure that we will be doing today is assessing your female genitalia and rectum, and for me to be able to do that po, I will be touching some certain parts of your body. Is it okay with you? So I will close the doors and close the curtains to ensure my client's privacy and ask the client to wear gown. After that, we can now proceed in hand hygiene and wear gloves. So after wearing the gloves, I can now proceed to inspecting the external genitalia of my patient. And first is, I will inspect the mons pubis for hair pattern, lesions, or swelling, and infestations. So, okay. Okay. So, the hair pattern is equally distributed. There are no signs of lesions and there are no signs of infestations. Next is I will inspect the labia majora. Okay. So there is no signs of swelling, there is no signs of redness, and there is no signs of sores. So after that, I can now proceed in inspecting the labia minora. So I don't see any positive of any signs of discharge, no swelling, no redness, no lesions. And next is after that I can now proceed in palpate with in Bartholin's glands if swollen and tender. Okay. So ma'am, masakit po ba if upon palpation? So there is no signs of swelling and there's no signs of tenderness. After that, I will melt the urethra only if symptoms exist. Check for drainage. After that, we can now proceed into the internal genitalia. So, I will insert a glove finger gently and check the opening size of the vaginal opening. Okay. So, I will insert a one fingertip, inspecting. So, the size of the opening is not too enlarged and there is no unusual discharge. And after that, we can now insert a warm or lubricated speculum to inspect the cervix. But I don't have it here with me, so I can now proceed into the next procedure. So, next is I will do a manual exam, one hand on the abdomen of my patient and two fingers inside. I will palpate the uterus and ovaries for size, shape, and any tenderness. So, upon palpation, ma'am, nakaka-feel po ba tayo ng pain? Okay. So, I don't feel any masses. I don't feel any tenderness. And there's no unusual discharge. After that, I can now proceed to a rectovaginal exam, index in vagina and middle in the rectum, and check the septum, pouch, and posterior uterus. After that, we can now proceed to the anus and rectum. So I will inspect the perineal area. So I don't see any unusual discharge. There's no signs of lumps, rashes, and sores. Okay. Next is I will check for the sacroiliac area for swelling, dimpling, and hair tuft. So there's no signs of swelling and dimpling, and the hair is evenly distributed. So I will next ask the client to bear down so I can check for the prolapse. After checking the prolapse, we can now examine the rectum. So I will check for stool. I will check stool for blood. And after that, I can now finish my assessing and document my findings, assist client to clean up and remove supplies and perform hand hygiene. Thank you.